a little bit fell into it. I think being in a private practice in a saturated area, um, patients were coming to me and really wanted someone who would listen to them and really focused on patient care. And in that, tinnitus patients I was finding that I was really able to listen to what their needs were and treat each case uniquely. And they started referring friends to me. And so I started doing more research on how to help people. And as we got busier and busier, I got involved with the American Tinnitus Association, and I've done everything I can to learn and research how to help people. What can we do that's different? I went to the International Tinnitus Research Initiative when I first started doing this in Spain,
Oh, wow.
just to kind of learn what else is out there besides a hearing aid, or, people are coming to me saying hearing, you just have to learn to live with it, and feeling just so depressed and isolated and alone. And we kind of take a different approach.
Let's talk about that. Let's talk about your approach. So tell me walk me through from when your first encounter with a patient, like what your steps are.
Sure. Well, it's different for everyone, but there are, sorry, it's different for everybody. So people will come in, they'll fill out, some questionnaires, paperwork, the THQ, the TRQ, paperwork that we have, and I'll read it because that's really important to read that versus asking them the same questions when they come in. And then we talk about what's going on. Why is this happening? When did it start bothering them? How long has it been bothering them for, and we'll kind of separate the appointment out into, is this a tinnitus curious patient who just wants to know what's going on in their body? Or is this a patient who's really distraught and bothered by their tinnitus?
I love that. Tinnitus curious. That's what I find I see a lot of. Just they want to know, is there something wrong with me?
Right.
There's something medically that I want to do. And once I find out that there isn't, then it's not as much of a problem for those. But for those that really have a problem with it, what would be some of the treatments or things that you would suggest for them?
Sure. So there are all kinds of things that we can do. So it's as simple as there are free apps on the phone, like Widex Zen, Resound Relief, Calm, Headspace, Sound Space. All of those things can be helpful, even a pair of sleep phones. I just started working with Neo Sensory, which is biofeedback on the wrist, and hearing aids, amplification. There's that really cheesy analogy, but it's a great analogy, the candle analogy, where if we think about tinnitus, I take you to a restaurant and we turn off all the lights and then I light a candle at the table. All you see is that flame. And if we think of that flame as a person's tinnitus, but I have a dimmer switch and I slowly turn the lights on, we think of that with low-level amplification, just brightening their world a little bit, bringing their awareness to different sounds. So here they are visually aware of the plates on the table, the food on the plates, the silverware, and the people that they're at the table with, and the waiters and waitresses, and art on the wall. And if you think of all those visuals, like things that you're suddenly hearing, and the lights are on, and you realize that you can't even see that flame anymore. It's there, but you barely even notice it. So sometimes we use amplification. Sometimes we do a more formal tinnitus retraining therapy. Sometimes there's really a hearing loss. And in almost all cases where there's a hearing loss of tinnitus, starting with amplification is the absolute way to go.
Okay. I was thinking that I love that analogy about the lights. And every time I hear it, I'm like, I love how you presented it. You just added something different about the candle. I mean, that's really helpful to present to people too. So what do you do if somebody comes in and they're very anxious and they're not sleeping? You and I are both talked about this a little bit before, so please
Yeah,
share that with me.
sure. So we see a lot of people who are very anxious, very depressed. There's that vicious cycle with tinnitus where you can't fall asleep, you're anxious, you're very stressed out. And I've been using and recommending CBD products. They're not psychoactive, but they have anti-inflammatory properties, and they can help people fall asleep and stay asleep. And I get notes from patients several times a week how, we do this test battery. There's nothing wrong with them audiologically. They don't have the budget for, amplification, but they need something, they need help. And so we treat it like a supplement. So this isn't anything I'm medically prescribing, but I've seen so much good in how it's helping patients. We collaborated with, there's a record producer in Atlanta that I am close with, and he has a brand of alternative music from when I was growing up in the 90s, and they have an alternative medicine branch, and they private label CBD for me. So I know exactly where it's coming from. I know who's making it. It's really headed by two women who they both have their degrees in kinesiology and have been helping people at Grady Hospital here in Atlanta. And now they're studying to get their degrees in cannabis studies from University of Maryland, where I went. So I know that's a great school. I know where they're coming from. And the feel I get from them is that they want to help people, and they've done a ton of research. And what's really nice as an audiologist is there's very little risk or work that I need to do, because I get to focus on what I do as the audiologist. And then I can reach out, or have my patients reach out to them directly with questions on, what kind of dose should I be taking? When should I be using this? Which product should I be using? But it's as simple as bath bombs I can give people who just need permission to relax. I think that's something, especially the last year and a half with everything going on, is self-care kind of goes by the wayside. And, I've read studies about how getting 2 full REM sleep cycles uninterrupted. So that's 3 to 4 hours times 2. So 6 to 8 hours of uninterrupted sleep. You're going to be more likely to mentally combat the tinnitus the next day. Right. So if CBD is helping somebody fall asleep and stay asleep, they're much more likely to be less affected by the tinnitus the next day. And they're also able to relax and fall asleep.
Yeah. Yeah. I love that you actually introduced me to this company that now my private label Aud.Bliss is through. And I'm going to be, having different interviews with the women that are involved in that as well. So I appreciate that, because I feel like they really do have a lot of knowledge. And I love the fact that you were using the bath bombs, because for people who may not feel comfortable ingesting it, they could at least get their relaxation through using the bath bombs. And, there's just still so much misinformation about CBD. And when you really delve into it, which I've done, as many of you know, and just learn a lot about why it works and how it works, and what the effect that it has. Like, it's almost like we all should be taking it for different things, because it really restores just balance back into our bodies. So it's really a great thing. And when you find somebody who's knowledgeable about it, like this company, it's really nice to have that beside us when we're dealing with our patients. So yes, so anyone that might be interested in learning about the Aud.Bliss CBD, you please contact me through this video, or on audbliss.com, audbliss.net, or through any kind of social media. And I will also post Melissa's information here. Oh, that's what I want to ask you in closing. So, there's a lot of emphasis these days on telehealth and teleaudiology and what can we do if, and this is what I find too, there's so many people that don't live close to somebody like you, somebody who really understands them and will not tell them there's nothing I can do. You have to learn to live with it. So have you done any teleaudiology? Are you considering that, et
Done
cetera?
a ton of teleaudiology, but it's very state specific.
Right.
So there are a lot of rules and regulations around it. However, with the pandemic, so many people, I'm on the board of directors at the American Tinnitus
Yeah,
Association.
that's another great